So now we can see here the calvaria from the inside. So the inner view of the calvaria, we can see first of all anteriorly we are having here the frontal bone, and both we are having here the parietal bone, and sideways we are having some part of the temporal bone, and the back side here we are having the occipital bone. So let's see that structure we can see in the cranial cavity. And first of all, here in the frontal bone we can see the frontal crust, and we can see here long way that is the groove for the superior sagittal sinus. We got here the brychma, we got here the frontal suture, we got here the sagittal suture, we got here the lambda, and we got here the lambdoid suture. The both sides we are having the suture between the parietal and the temporal, that is a squamous suture, as we can see here. We can see some depressions here, that the glandular fovea, and we can see here the impression of the meningeal arteries, especially the middle meningeal artery impressions we can see here inside both way. So in the cranial cavity, after cutting the calvaria inside, when we can see here the frontally we can see the frontal bone, and then we can see in the middle this blue color is representing the ethmoidal bone, and this green color is representing the sphenoidal bone. Sphenoidal bone from one side to the another side of the cranial cavity is reaching. And after that we can see here that is the temporal bone, mainly the pitous part of temporal bone you can see here. And we can see here the occipital bone, a very big foramen in the middle, the foramen magnum and the occipital bone. And here we can see both sides, that is a part of the parietal bone, and here we can also see the part of the parietal bone, both sides. Now we're going to talk about the anterior cranial fossa. In the anterior cranial fossa, we can see here the frontal bone, which is making the roof of the orbit, and we can see here the ethmoidal bone. And now we can see what structures there. We can see here the frontal crust, we can see the foramen cecum. Foramen cecum is electing the missionary vein to the nasal cavity. We got here the Gribri plate form foramenia. From here the olfactory nerve fibers are passing through, and in the middle here we are having this elevation that is known as the crista galli. And here we can see the frontal bone is making the joint with the lesser wing of the sphenoidal bone. Okay, so in the anterior cranial fossa we can also see here the orbital part of the frontal bone. We can see the frontal crust, we can see the foramen cecum, we can see the crista galli, Gribli plate form foramenia. We can see here the body of the sphenoidal bone, we can see the lesser wing of the sphenoidal bone, we can see here the anterior glenoid processes, anterior glenoid processes. So now we can see the middle cranial fossa. Middle cranial fossa, we got here the bones, as the sphenoid bone we can get here, we can get to the little part of the parietal bone, we can get here the temporal bone. So let's talk about the middle cranial fossa, what structure we can see. In the middle cranial fossa, first of all we can see here the tuberculum celli, we can see above that the chiasmatic sulcus, we can see hypophyseal fossa where the hypophyseal gland, what is known as pituitary gland, is going to stay down, and posteriorly we can see the dorsum celli. So at this place what we can see here, we can see the lesser wing and the greater wing of the sphenoidal bone, the both side. We can see here the optic canal, we can see the supraorbital fissure, we can see the foramen rotundum, foramen lacerum, not very much clear, we can see the carotid canal, we can see the foramen ovale, and later to the foramen ovale we can see the foramen spinosum. Here we can see the pitous part of the temporal bone, and inside this part we are having the inner ear and the middle ear. We can see here the posterior clinoid processes, and we can see here the groove for the height groove and the hiatus for the lesser petrosal nerve, and this part we call that tegmen tympani part, tegmen tympani. Okay, so now we're going to talk about the posterior cranial fossa. In the posterior cranial fossa, we can see here the part of the temporal bone. We can see the part of the our sphenoidal bone, and the most of the portion in the posterior cranial fossa we are having the occipital bone and a little part from the parietal bone. So what marking we can see here, this sloping downward, this is known as the sylvus, and the both side here the elevated process we call that jugular tubercle, and we are having the groove for the inferior petrosal sinus, and this one here we are having the superior border of the petrous part of the temporal bone, and this place we are having the groove for the sigmoidal sinus. We got here the foramen magnum, we got here the internal occipital crust, and here we got the internal occipital protuberance, and the both side we are having the groove for the transverse sinuses. Okay, in the cranial cavity we can see here from the superior view, the cranial cavity could be divided into the anterior, middle and the posterior cranial fossa. So in the anterior cranial fossa, what we can see there, we can see the frontal bone, we can see the ethmoidal bone. So when we are looking at the ethmoidal bone that we are having here, the cribri platform foraminium, from where we are having the olfactory nerve, number first cranial nerve that is passing through here, the fibers of this nerve. So second we are talking about here, that is the optic canal. The optic canal is present in the middle cranial fossa, so it is letting the optic nerve and the ophthalmic artery to pass through here. And then we are talking about the supraorbital fissure here, so both sides. The supraorbital fissure is the fissure also in the middle cranial fossa. It is letting the structure to pass through, that is the ophthalmic division of the trigeminal nerve, oculomotor nerve, trochlear nerve, abductor nerve and the superior ophthalmic vein to pass through. After that we are having here the foramen rotundum. So from the foramen rotundum that is also present in the middle cranial fossa, we are having the maxillary division of the trigeminal nerve to pass through there. Now we are having here the carotid canal and also the foramen lacinum anteriorly, posteriorly the carotid canal. The foramen lacinum is filled with the cartilage, and the carotid canal we are having here the internal carotid artery to pass through from here. Next we got here laterally to the carotid canal, also in the middle cranial fossa, we got here the foramen oval. Foramen oval we are having the mandibular division of the trigeminal nerve to pass from here, and we got here lateral to the foramen oval the foramen lacinum, the foramen spinosum. So the foramen spinosum is letting the middle meningeal artery to pass through it, which is the main artery to supply the meninges. Next we are talking about here in the posterior cranial fossa. In the posterior cranial fossa we are having here the jugular foramen, we got here the internal acutis meatus, and from the internal acutis meatus we got here the facial nerve and the vestibulocochlear nerve to pass through there. Labyrinthine artery and vein is also following them from this canal. After that we are having the jugular foramen, very prominent, and from the jugular foramen we are having the glossopharyngeal nerve, vagus nerve, accessory nerve and internal jugular vein to pass through there. Again I will repeat, the jugular foramen we are having here the glossopharyngeal nerve, vagus nerve, accessory nerve and internal jugular vein is passing through here. We got the hypoglossal canal. Hypoglossal canal is letting the hypoglossal nerve to pass through there, which one is number 12 cranial nerve. We got a very big foramen here that we call that foramen magnum. From here we are having the structure passing through, that is a spinal cord, vertebral arteries, roots of the accessory nerve, number 11 passing through, which one is coming from the spinal cord. So that we go to the foramina in the cranial fossa from the internal view. Thank you.